My name's Becky Lewis. I'm the Strategic Safeguarding Quality Assurance Service Manager in Bristol City Council. But I'm here because I am chair of the Keeping Bristol Safe Partnership Child Safeguarding Practice Review Group. And I'm joined by my colleague Becky. You've got the double Becky today, which is obviously going to make this a good Friday. So I'm just going to hand you over to Becky Dybal to introduce herself.
Hi everyone, my name's Becky Dybal and I'm a Project Support Officer for the Keeping Bristol Safe Partnership. So I support the Child Safeguarding Practice Reviews for KBSP.
Brilliant. And we're here today to talk about one part of our quality assurance and learning review cycle for the Keeping Bristol Safe Partnership, and that's our rapid reviews, and that's the statutory process that we use to learn from the most serious incidents that happen to children in our city that result in the serious harm or death of a child in the city because of abuse or neglect. So the content of this training may have we're not going to talk in detail about any individual child, but there obviously may be some parts of it which are difficult for some people, and you can of course step out and mute or step away at any point if you need that. But we really hope that this will be a helpful and informative session today. The Keeping Bristol Safe Partnership brings together partners from right across the city, including education, police, local authority, health partners, voluntary sector, fire, probation. It extends out to our citizen and youth groups. We engage in different projects with our faith groups. So kind of the whole kind of gamut, I guess, of people who come around children and families over the course of their lives and play a really important role in keeping them safe. And we obviously spend a lot of time looking at what's going well in the city and learning from good and looking at our performance data and projects, but it's really important that when things go wrong, and unfortunately children are seriously harmed and children do die in the context of abuse and neglect, that we take time to really think about what happened and if there's anything we could do different in the system that would prevent that in the future. So this process, and Becky's going to tell you a bit more about it as we go through today, sits really alongside some of our other statutory safeguarding review processes. So the child death review process, of which the board is a part, our safeguarding adult reviews and domestic homicide reviews. We sometimes see review processes such as mental health homicide reviews, depending on the context of the incident that's happened, and through all of those processes, MAPA reviews, the partnership is looking to really learn what we can about what happened and what we can do differently. And I'm really pleased to be able to have this today, because this is a part of the process which is perhaps less transparent across the whole partnership, because it is our kind of immediate response, immediate debrief process to think about what could have been done differently and what needs to happen kind of in that immediate space to safeguard children. It's not a process where there are reports which are published, and Becky will tell you a bit more in a bit about the cycle and how we contribute to kind of national and local learning. But we are really pleased to be able to come and meet with you today and talk thematically and be transparent and open about the thematic data about what's happened in our city in the last kind of 21 months, and what we've learned from that. And hopefully as we talk, you'll be able to piece together some of what you've seen in your own development of services, learning and development, and perhaps for your individual teams who may have been involved with some of these children and their families, how that's fitted to some of the strategic intentions and kind of learning from today. So Becky, would you be able to share the slides?
Okay, can everyone see?
It's just loading on mine.
Okay.
So at the moment we can just see it with your notes. So if you could just pop it onto that.
Oh, no, that's not the first one. There you go.
Perfect, thank you. So I think if we click onto the agenda for today, Oh, I just want to let everyone know that we are recording this session. If you don't want to be seen, obviously keep your camera off. The view is focused on speakers, but so the plan for this session is obviously some people won't have been able to attend today, so we're going to make sure that it is on our Bristol Safeguarding website and accessible for people who weren't able to attend today. So just needed to make sure you're aware of that. Okay, so our plan is that we're going to talk to you a bit about the process and the legislation around the process. We're then going to talk to you about the National Child Safeguarding Practice Reviews and how we intersect with them. And we're going to give you an analysis of the rapid reviews since July 2018 when this process began, and kind of the demographics and details of some of the children and the factors involved for them and their families. We're going to then talk about some of the key themes that have come through our safeguarding rapid reviews, and you can see them listed there. There'll then be time for questions and answers, but you can also kind of stay in dialogue and conversation with us as a group, either through your representatives from the different sectors on the Child Safeguarding Practice Review group, or if you don't know who that is, directly through the Keeping Bristol Safe Partnership email address. So without further ado, I'm going to hand over to Becky, who's going to take you through some of the legislation, guidance and processes.
Thank you, Becky. So first of all, if we look at where CSPRs and rapid reviews have come from, you might be familiar with the term serious case reviews. So serious case reviews were established under the Children Act in 2004 to review cases where a child had died and abuse or neglect was known or suspected. This process changed with the introduction of the Children and Social Work Act in 2017 and Working Together guidance in 2018. There we go. In this guidance, a new legal framework was introduced for safeguarding arrangements for children. So the responsibility for how we learnt lessons from serious child safeguarding incidents, it now rests with at a national level with the Child Safeguarding Practice Review Panel, as well as at a local level with the Safeguarding Partnership. In Bristol, that Safeguarding Partnership is the Keeping Bristol Safe Partnership, which is made up, as Becky's already mentioned, of the Bristol, North Somerset, South Gloss Clinical Commissioning Group, the Avon Somerset Police and Bristol City Council. So the partnership are responsible for undertaking rapid reviews and sharing our findings with this the national panel, the National Safeguarding Practice Review Panel. And where it's relevant as well, we also commission the local child safeguarding practice reviews. I'll go into more detail about when we do a local and when we do a rapid review in a few slides. So this change of structure has given a more national ownership of the more thematic issues, as well as being able to broaden knowledge and learning outside of the local area in which a serious incident happens. So you can see from more of a national view, not just what's happening in Bristol. Okay, so next, I'll go into some further details about what happens in the process from a rapid review to a child safeguarding practice review in a minute. But first of all, we just look at what is defined as a serious case. So in Working Together 2018, it is defined as a serious child safeguarding case in which abuse or neglect of a child is known or suspected, and the child has died or has been seriously harmed. So serious harm can include serious and or long-term impairment of a child's mental health or intellectual, emotional, social and behavioural development. It can also include physical health. So what happens when a serious incident happens? So once aware of an incident that fits in the criteria, the local authority has 5 days to make a notification to Ofsted and the Child Safeguarding National Review Panel. And they also inform the Keeping Bristol Safe Partnership that a notification will be made. At this stage, Other agencies can make referrals if they become aware of serious incidents, and if they're aware of a serious incident that they believe meets the criteria for serious harm, they can fill out the referral form, and there's guidance, and the form is kept on our website for that. So it is available for other agencies to be involved. It's not just those three partner agencies. So in that case, once a referral is received, it will be considered by the safeguarding partners, so the CCG, police and the local authority. And those three partners, they decide whether to make a notification. So once the notification has been submitted, a rapid review is triggered. And this process must be completed within 15 working days. So it's very, very tight and very rapid process. So that process includes writing to services and organisations involved with the young person or the young people, to ask for relevant information about the child or the young person. And also within the 15 days, a rapid review meeting is held to discuss the information and to look at what could be done to improve the systems. Also within this meeting is discussed whether the case should proceed to a full child safeguarding practice review. So if there's areas that feel like they've been missed, or if there's further areas for further exploration, then the group might recommend that a full review takes place. So this is written up in a report along with a recommendation, and this is submitted to the national panel. So once the report is written, the learning is shared with the family and the young person if it's suitable to do so at that time. And the learning is also shared with partners, so any practitioners involved and locals, the safeguarding partners as well, and any immediate actions that have been identified throughout the review process start to be implemented. You see the blue box there, whether to proceed to a local or national CSPR. So as I mentioned just then, that will be discussed within the rapid review meeting. That group will make a recommendation to the national panel, and then the national panel will consider it, and they'll write back to say whether they agree or disagree with the decision that's been made, and whether they believe that there would be benefit in doing a national review or a local child safeguarding practice review. Okay. So just going to give a brief overview of the national child safeguarding practice reviews that have taken place so far. So the first one that took place between, so it's looking at cases between 2018 and 2019. It was hard to escape, and it's about safeguarding children at risk of child criminal exploitation. This review was published in 2020. Becky Lewis has also done a whole webinar on this review, so I'll share a link to that within the chat so that people can check that out. It's on our website on the webinars page. And also the review is available to read online at the government at gov.uk. And the next one is safeguarding children at risk from sudden unexpected infant death. That was also published in 2020, and that's also available to read on the gov.uk website. And there's a third national CSPR about non-accidental injury in children under 1, and this one's not yet published, it's still underway. Okay, I'm going to hand over to Becky to give an overview on the rapid reviews that have happened in Bristol so far.
Thank you, Becky. I think it's really fair to say that the partnership and nationally we've really welcomed the rapid review process. So for those of you who've been previously involved in serious case reviews, you know that they can take quite a long time. We were seeing it taking nearly a year from the incident to be published, sometimes longer if there were concurrent criminal investigations, for example, or particular complexity. And this process has really allowed us to be a lot more nimble and be much more responsive in the system to responding to the issues that we see. We've held 12 rapid reviews since the process began in July 2018. They involved 14 children and 1 multi-child residential care setting. In that group, there was also 1 rapid review for an out-of-area child where the incident took place in Bristol. So the local authority where the harm took place is responsible for the rapid review process and the child safeguarding practice review process. So if a child is harmed in Bristol but lives in another local area, it's our responsibility. And we worked with the other area to agree who would lead on it and accepting and moving forward those recommendations. You'll see that we have had, you'll see the numbers on the screen of the kind of numbers of rapid reviews we have had. I'm going to talk a little bit about the impact of COVID shortly, and you'll see there's been an increase in 2020 and into 2021 of the number of rapid reviews. So I'm going to talk a little bit about that. That reflects national data, where we've seen nationally over COVID an increase in serious incidents involving children. The other part of that, though, is that there is increasing familiarity around the rapid review process and increased confidence around applying it. So we know that I think, you know, serious harm, in the same way significant harm and other forms of harm are quite you know, subjective, and often it's about the partnership thinking about how we understand and interpret that, and making sure that we are thinking effectively and proportionately about the right children. So we would, you know, we'd also probably seen a bit of an increase as well because people are becoming more confident in knowing how the process works around serious harm. Obviously, death of children is much kind of clearer, but I think we're getting more confident in thinking about when children have survived, but there's been a serious impact for them in relation to the abuse or neglect that they've experienced. So I think if you want to take it on a slide, Becky.
Okay, so we're just going to look at some of the statistics from rapid reviews that have taken place in Bristol. So the first graph on the left is looking at the categories of harm. You can see the largest category by far is knife crime / peer-on-peer abuse. So that's 42% of all of the reviews that have taken place in Bristol, and then that's followed by non-accidental injury. And then you can see on a very even level, it's followed by organisational abuse, culturally harmful practices, alcohol and drug abuse, and concealed pregnancy. So that's just looking at the reviews, so categorising it by review. The following data is going to be looking at the children that are subjects to the rapid review. It's worth noting that because it's quite a small sample, that we haven't cross-referenced the type of harm with the demographic information, because it would just make the children too identifiable. So yeah, it's just looking at the data separately. So yeah, this following data is just looking at the young people in the rapid reviews that we did for individual children or groups of children, but it's not including the review that we did for the multi-child residential care setting, because that was a review of a setting rather than individual children. So looking at the first graph on the right, you can see that out of the 14 young people and children that were subject to the rapid review, sadly 4 children have lost their lives as a result of the serious incident. So that's 29% of the sample, and then the remaining children and young people experience serious harm but have survived their injuries or experiences. Have a look at the age of the children. You can see that there were 4 children that were under the age of 1, and then there's quite a big gap, and then we go up to the rest of the children were in either early adolescent or mid to late adolescent age. Looking at gender as well, you can see that the majority were male, 71% male and 29% female. And looking at ethnicity, you can see the largest group at 30% is Black or Black British Caribbean, and next largest is well, two groups, so White British and Asian, both at 21%, and then the other two group, yeah, so you've got White British and Black Caribbean and any other Black background or any other mixed background as well.
So I just wanted to come in at this point to talk a bit, because you'll be able to see there's real disproportionality in this data when we consider the impact on boys and young men in the city, and also considering Black and Asian young people. In terms of looking at the age groupings, they absolutely align to long-term trend data and research around serious incidents, and follow some of the national trends which you'll hear about as I talk, in relation to the risk to infants and babies, and then the risk to adolescents. And we'll talk a bit more about that in the themes. In terms of the ethnicity and gender data, that significantly parallels the fact that Black children are disproportionately impacted by harm in relation to extrafamilial harm, particularly child criminal exploitation, peer-on-peer abuse and knife crime, and also young people from Black and Asian backgrounds being obviously disproportionately represented, given that we've had reviews related to harmful cultural practices. But what it also really tells us is that we need to think really carefully about how effective our systems are at responding to abuse types which disproportionately affect those communities in our city. And they're conversations that we hope that you'll take from this review to think across the themes that we're talking about today, thinking about the accessibility of services, the accessibility of your services, the impact of services that are delivered. You know, are we having as much positive impact for young people from Black and Asian backgrounds as we are for young people from white backgrounds, and considering that in the round as we go through today. And I think it's really, when we look at this data across, you know, a couple of years, it provides real challenge to us as a partnership and as a wider system to think about the effectiveness or otherwise really of our safeguarding systems for Black and Asian young people and children. What I wouldn't want people to think from this data is that this related to Black and Asian families being more likely to harm their children. This data really mixes together extrafamilial harm types and intrafamilial harm types, and you'll have seen that in the kind of range of themes that the reviews have covered, and the high level of harm that's been experienced outside the family home. The person causing the harm, we actually haven't broken that down in this data, but there's clearly kind of a high level of correlation with peer-on-peer harm and harm from people outside the family home on these young people's groups. So I think we just need to be really careful with the data, but also and also recognize we're working with a relatively small cohort of 14, but it is really stark and it's really notable, and it should lead us to really kind of question ourselves and think about what we could and should be doing differently as a strategic leadership group, as operational practitioners, in all of our interactions with children and families. Thanks, Becky.
Thank you. And so we've got a last slide looking at the statistics. If you look at the graph on the left, it explains the area living in at the time of the incident. So it doesn't necessarily mean where the incident took place, it's just where the child was living at the time. So you can see the largest percent is East Central, followed by North, Bristol, then South, and then there was one child that was living out of area, but the incident happened in Bristol. You can see in the middle chart that 86% of the children were living at home, and 14% were children in care at the time of the incident. And finally, looking at SEND needs, you can see that 21% of the children had some kind of SEND needs, and then 72% didn't, and then there was one, it was unknown. So that's all of the data from the rapid review sample.
Thank you, Becky. So I'm going to kick us off with talking a bit about what we've seen in relation to serious harm in COVID. So I touched on, as we talked around some of the data earlier, the impact that we've seen nationally and in some of the national statistics that are all available actually on the government's websites in relation to increased notifications of child death and serious harm during the COVID period. And these are some local findings that we found. As I talk about the themes actually today, it's worth me saying some of these themes link from good practice and things that we saw that were working that we need to do more of, and some of them relate to areas for improvement, and some of them are trends and themes that we just need to hold in mind. So there'll be a bit of a mixture today. One of the things that we've seen really positively, that while hasn't presented these serious incidents or child deaths or children being seriously harmed, was in place, which perhaps hasn't been in other areas or other safeguarding partnerships, was that in the main services have continued to deliver proactively through COVID. So we haven't looked at any rapid reviews of children in this period where there wasn't contact with professionals, and actually most of these children and families did have face-to-face contact with professionals, some online and virtual support. The issue though with that is it doesn't replace their connections with their wider communities, and the levels of isolation were really significant factors for some of these families. So for example, parents who were managing with real adversity and were finding it difficult potentially to access some of the parenting groups, parent support, children's centres, just community conversations really with people in their neighbourhoods, because of COVID. So those universal plus services that come around families and help them feel connected to their communities and less alone, we could really see kind of the tensions around that, and that professionals are never going to be able to replace that. And it really kind of evidenced for us the importance of networks, of communities, of making sure that families feel that they have a place within their communities. We also have seen patterns of increased hidden harm, so serious incidents where the children were only known, or babies predominantly in these cases, were only known to universal health services. So a couple of instances of children and families who were kind of completely unknown to parents, to professionals, beyond the kind of universal midwifery and health visiting offer. And I think we really realise and think about over the course of this period of time and ongoing, even as we come through COVID, the hidden harm really for families, or hidden adversity that families are struggling with without that connection with perhaps their GP services, education services, employers. So we kind of notice that pattern. To be fair, when we look at our under ones, that is a pattern that we have seen over the last few years, which is where we've seen a pattern when there's been harm to infants. Becky, we can see your notes. I think the screen's disappeared. Thank you. So hidden harm to babies and infants, where we've seen a pattern of children dying or being harmed, where there's kind of been no wider service involvement, and in some cases not a particular history or kind of the normal evidence of concerns that we'd think about, but that's clearly been emphasised through COVID, and I'm going to talk a little bit when I talk about that theme in particular about some of the areas we think needs to be developed right across the system really to keep children safe. we did see in some of that cohort an impact for the initial redeployment of public health nurses, and that was a national trend. So in lockdown 1, there was some redeployment of, for example, our health visiting services to respond to the pandemic. And I think given the national and local learning around the trends for vulnerability for under ones in this period and the increased risk to babies and infants, the importance of those roles just absolutely can't be minimized. And we as an executive and as a partnership, we're really lobbying government and nationally to recognise the importance of them as a protective factor, and that absolutely has been the case since that first lockdown, and just shows the importance of kind of investing in those early years services longer term. And you'll have seen that through some of the COVID guidelines going forward, with increased kind of permission and support around sort of care support bubbles for infants and access to early years and nursery, and obviously public health nursing. We have seen factors across the reviews that we've done in the last year around the impact on families around stress. So impact around kind of unemployment, poverty increasing. We've seen some trends in relation to the impact on families' mental health as well. But with such a small cohort, we're just pulling out some key themes here, and it's really in some of that national data that we start to kind of understand that picture better, which is why that improved link between local and national is so welcomed. We have sadly also seen an increase, particularly in the last few months, of increased unexpected pregnancies or concealed pregnancies, which have resulted in some cases in harm to baby and mother, but in other cases where we've seen that increase in the last few months, there's obviously really significant health risks to both around that. There's such a wide range of reasons why a woman may not access, or maybe a late booking to health services, may not access maternity services quickly. We're thinking about, but some of the things for you to think about in your delivery of services is for young people and young adults, particularly the ability to access sexual health services, and Unity remains open, and that's really important to say. We really need to promote conversations about sex and sex education and support and access to emergency contraception and obviously more planned contraception, conversations about pregnancy advice. And I think the barriers about particularly if young adults have had sex where they've not, where that's outside of COVID guidelines, we can obviously see some increased kind of barriers for them potentially accessing some of that support. It makes it really important for us to promote and support people do that in the community. It's also much harder, I think, has been at times for individuals, including women who may be experiencing coercive control, domestic violence, may have caring responsibilities for others who are vulnerable, to feel confident in accessing health services. For example, they might have health anxiety about the risks associated with that, need a lot of support about the safety of health services, but also the risks, I guess, around coercion and control, and people being kind of trapped in their own homes and not being able to discreetly access any pregnancy advice and support. So in your safety planning and working with families, there are elements you really need to think about and kind of proactively think about sex and relationships and pregnancy advice as you would normally, but recognise that some of those interfaces are kind of more challenging for them at the moment. We also know that there's potentially women who would have sort of been seen by community services just in their day-to-day, who aren't kind of having that contact with professionals more regularly, and perhaps where pregnancy might have been noticed, or they may have had conversations with friends or supporters, that's not happening as organically. So there's something we've just got to watch. We've also seen an increase in criminal exploitation, county lines and trafficking increase over this period. So we are, I think it's been quite widely nationally reported, the concerns around the increase in kind of county lines, drug dealing, and the involvement of children and young people within that. So we've definitely seen more concerns around kind of the organised elements of exploitation, which is perhaps a shift from that peer-on-peer serious violence. Could you click on, Becky? So I'm going to take you on to thinking about kind of non-accidental injury in under ones. So some of the key themes coming out of that work, and some of them will feel very familiar to you, and some of that relates to why there are national reviews in this area, because we're really trying to see what is going to make a difference, what works in some of these areas of increased vulnerability for children. But a regular theme around how universal midwifery and health visiting services and a wider kind of children's centre and family offer for those younger age groups can engage with fathers. So the invisibility of fathers, particularly when we have had booking in this year where we've had booking appointments and scans and things where you haven't always had times where the partner's been allowed, has been really challenging. And somehow we also need to think creatively and as services and a system about how we could develop that offer and model to reach fathers. And that, is a kind of message that has gone back up through national government repeatedly, and we hope will come out of the national review into non-accidental injury, which Bristol's been involved in as well. Some of the things they're kind of thinking about is around how do you have a universal offer for fathers and other parents of whichever gender alongside the mother. So yeah, thinking about how we can kind of make that a universal offer, and also kind of start to shift culturally how we view caregivers. We have seen a pattern, again a trend seen over many years, but of increased likelihood of care experienced parents to be involved in serious incidents which involve non-accidental injury in under ones. And clearly that links to their experience of adverse childhood experiences themselves, their own experiences of parenting, a kind of whole range of difficulties around their own attachments and patterns. What we don't want to do is push those parents into kind of that everyone whose care experience is felt to pose a risk to their children and should be assessed under kind of social work. We need to maintain our kind of curiosity and our risk assessment in that. What we do want to see though is an enhanced offer for them. We know that their kind of models and support around parenting may have been very disrupted. So our children's centre, I'm going to talk actually on the next slide, but as we go, just to say our children's centres and our children in care service are building up a kind of bespoke package for care experienced parents that we hope will kind of promote them to be able to access support around their own parenting journey and that preparation for parenting. We've seen need to improve some of the information sharing and handovers between midwifery and health visiting. We've seen that there seems to be an increase in accidental injury when there's kind of increased stresses for babies. So particularly where babies are difficult to settle, crying a lot, and they're struggling to soothe them. That might be because of the parents' own skills, but more likely, and where we see more themes have been around colic, hearing loss, other reasons where you might have a baby who is, where there's the parent is struggling to settle, not getting a lot of sleep, and that really links into some of the research and thinking around sudden unexpected infant death. We've kind of seen a lot about the importance of information sharing and early multi-agency coordination in pre-birth assessments, linking into kind of care experienced parents. For our social workers who might be on the call, the really importance of getting, if you're working with a care leaver, the importance of getting really robust information from the local authority, for example, if they're an out of area local authority where they were a care leaver, from other authorities and internally within ourselves about that parent's needs and experiences as part of that pre-birth, but also making sure that we're using the tools that we have available to us in some of our existing information sharing, such as our Think Family database, to trigger us to think about which other partners we might want to get information from. So this is wider than just care experienced parents, but looking at our kind of pre-birth assessment process. And for the social workers on the call, there's going to be some support and guidance coming out of a piece of work Nicola McGrath and Alenia are doing, that's being supported by some of our midwifery colleagues. So that's something to look forward to in the future. We've really seen the benefits of kind of evidence-based, attachment-focused parenting interventions. And by that, I mean interventions such as family nurse partnership, VID, some of the kind of Rockabye and some of the kind of antenatal programs. What we find though is the accessibility or the confidence of some of our most vulnerable parents and parents with ACEs is sometimes less around accessing those services. And there's also potentially a kind of cultural element to the confidence of some of our communities at accessing parenting programs. And so continuing to look at how we can reach the widest population and potentially, you know, a lot of this is about attracting and supporting parents to engage, because if they haven't self-disclosed kind of previous adversity within their midwifery appointments, we might not know. And so both looking at how we proactively engage with some of our kind of targeted cohorts, but also how we kind of attract and make accessible those amazing kind of pieces of work to the broadest kind of cohort of parents. And we've also seen the importance of everyone in the system understanding the role of the perinatal mental health pathway and understanding of adult attachment and mental health needs. So by that, I'm talking about there's the perinatal specialist mental health team in AWP. They're able to give advice and guidance. They've got a consultation line. We've also got within both UHB and MBT some specialist mental health midwives who can provide some more support based work. And then there's the wider VCS organisations such as Bluebell and others that can provide support in the perinatal period, which runs right from pregnancy through to 1 year of birth. But within that, what we sometimes see is like misunderstandings about role in the perinatal pathway. So the difference between secondary mental health services being involved and perhaps our specialist midwives and what they can offer and how they differ. Some lack of kind of specificity sometimes when we talk to each other about what those parents' mental health needs, what that looks like for them and how we might know if they're becoming unwell, and that being much more specific within our safety planning and thinking around children. So for example, if a parent's had a diagnosis of a mental health condition, often we aren't digging into that enough with them and with the professionals around them to say, what does it look like when you're unwell? How would we know, and what would that plan look like? So sometimes we're not getting under the diagnosis enough, not enough kind of personalization around that in our kind of multi-agency conversations. And we've also got some work to do to think about that pathway in the perinatal period, because a lot of the specialist services are for women who are presenting as unwell in that period. And what we know is there are increased risks for parents where there has been kind of previous mental health difficulties, previous adversity and challenges. And so we just need to keep kind of thinking and working together around making sure those support packages are as flexible as possible, working with partners to be part of that safety plan, but really with enabling that woman to kind of talk about how we're going to kind of navigate this period, because perinatal mental health really fluctuates through the pregnancy period and across the first year of life. I know we did a lot of workshops and work around this when we published the serious case review into Charlotte and Zani Bevan's death, which is still available on our website. And we've got the mental health protocol, perinatal mental health protocol as a partnership. So I'm saying that there because those resources are still there for you. But we think it's probably time for us to bring some of that learning and development and workshops background. So if, you know, put in the chat if there's kind of areas you're particularly interested in us doing more webinars on and things as I talk, but that's kind of a plan really for us, and to kind of keep learning in those services. Could you click on, Becky? So this is just some of what's happened already. We have locally adopted the ICON programme. You'll have seen some of that being adopted nationally. That programme is a programme to support parents where they are perhaps struggling with baby crying and how to manage babies who cry. Obviously all babies cry, but frequent crying, and just techniques of supporting and accessing support quickly if parents are struggling in that kind of infant period. That's something we can all promote. They will be offered it through their midwifery and health visiting services, but it's something we can, there are apps that download, there's resources online. So it's really important that, we're all kind of engaged in supporting that programme, and also proactively offering that to fathers, so that, at the moment, mothers are often gateways to fathers, and we're trying to find processes that can help us kind of directly go to the father themselves. There's been a lot of work over the last couple of years to improve the recording systems in kind of early years of mental health nursing, because of kind of paper records and not everyone having use of computer systems. Sometimes that made it quite difficult around information sharing. So there's been quite a lot of work in that area, and also rolling out more of use of connecting care, which is a system that links social care and health records, and can help be a tool really for prompting us to think about who's involved and why. Talked about a couple of these other elements. Oh, and linked to the COVID risks, which I talked about earlier, and this, but also more broadly right across the partnership. Hopefully you've all seen our Are You OK campaign. So that's been run right across the pandemic. It's gone out in local newsletters, from there, it's on bus stops, it's on mobile, the newsletters through the council. We've had it through gone out through a lot of the partnership mailings. So Instagram, Snapchat, Facebook, it's been on all those platforms, targeted at different groups, different resources, but essentially it's a whole range of kind of advice and support, both about how neighbours and families can better support their friends and family over this period, and also about the kind of graduated service response and where they might need help at different times. So help themselves, and then kind of graduated into targeted and specialist services. So if you haven't seen it, there's a lot of stuff on our website, but also out managed through our different partnership communication teams, and on our Twitter and all that sort of thing. Okay, Becky, could you take us forward? Brilliant. Okay, so I'm now going to come on talk about adolescent safeguarding. Sorry, this is a real whistle through some really meaty subjects, but I hope it gets you thinking, helps you think what areas you might want to kind of develop and explore yourself in more detail. When we talk about adolescent safeguarding in this context, we've really been looking at the cases we've had where adolescent children are affected mainly by familial, parental concerns. So adolescents where parental mental health was a factor, parental drugs and alcohol use was a factor, where there was kind of difficulties or issues around like long-term neglect in those families. So the kind of some of the key themes coming out of that work I think are really well summed up by Des Holmes's from Research and Practice phrase, risk, resilience and relationships. So for us, what we could see is some excellent practice in this area, but also some opportunities to do things better, as always, in terms of how we conceptualize and understand risks to adolescents. So how do we think about and make sure we hold in mind the risks that parental need can continue to affect adolescents, but it is likely to affect them differently than perhaps younger siblings or themselves when they were younger. So by that, what we've seen a need for that to move forward is, for example, where we've had parents who have been in mental health crisis, parents where their management of their substance misuse and has really affected the kind of adolescents in their lives, and perhaps both ways different parts of the system haven't thought about each other. So I think we're pretty good now for our under 10s in making sure that adult mental health services, adult drug services like roads are well integrated in our multi-agency plans around younger children, and we really kind of consider them in the context of the familial risk, but actually we had a couple of cases where children weren't thought about, for example, in risk that came out of some of those situations that I've described. And the importance of our colleagues in adult mental health, housing and drugs and alcohol services, really thinking when they're assessing risk to the adult individual, what that transferred risk is in relation to their parenting. And sometimes when they had older children, that consideration was missed. And so we really want to promote that importance for adult services to continue to think child. But we've also seen some examples, some of this is out of area, some of this was in area, but of adult services not being invited or involved in multi-agency plans when there's adolescent children. And one of the kind of key bits I want people to think about is when you have children who are having contact, having family time, seeing their families, so not necessarily children in care, but children who are continuing to have relationships with their family members who they don't live with. But how are those family members involved in safety plans, child protection plans, child need plans, and how are we thinking about how those family members who may not be in the same area as the child involved in thinking about safety. So for example, there was an example where the team around the child didn't have a good understanding at all of a parent's changes in drug use, because the engagement was felt like at a distance because they weren't kind of living with the child, and so that was a kind of a gap really where there was a lot of knowledge in another part of the service and in the system, and a real opportunity for them to be involved in some really good thinking and safety planning, and for that parent to play a much more active role, actually much more defined role in the safety of their child. We also know we need to think about resilience, what builds resilience for adolescents. It's this is not going to be we don't have time to look at adolescents in great detail here. You might want to go on our adolescent safeguarding training if you'd like some more time, or have a look at some of the research and practice resources actually. But of course we are working to support children to be safe into their independent adulthoods, and often it's about conversations about risk and rights, risk enablement. What is the level of risk we can tolerate? How do we build resilience? How do we support these adolescents to build their independence? And what is the quality of the relationships they've got with the professionals around them? So in adolescents, that real importance around kind of having trusted professional relationships with continuity, which aren't always with the professionals we expect them to be, and how we support those professionals. So hopefully that kind of phrase can sit with you and give you a bit of a frame for those conversations, because there's no kind of right, really when you're working in adolescent safeguarding, it's about thinking about those principles, and we need to have really explicit conversations with each other to make sure we kind of share our risk assessments and our approaches and really think about the interventions, and that we have those with the young people obviously and their families. There has been a small trend around the need for support for adolescents affected by their parents' drug misuse, and just an opportunity here to plug the brilliant work around that BDP do around hidden harm and the Drugs and Young People project. And it's been fantastic. BDP won some more resource in the last year and have launched a new LEAF program for young people affected by cannabis use. We see that kind of impact of familial drug use and young people who find cannabis and other substances more problematic. So making sure you kind of are really aware of those resources, and sometimes their drug misuse can get missed in the wider risk. So what we found is those young people, there was so much activity around the neglect and the parental difficulties, the adversity, them being out of school, the kind of chaos, the youth offending, that sometimes the kind of underlying substance misuse or adversity they'd experienced within their family was missed. So it's something to hold in mind. And we know that we need to keep working on this balance between intra and extra familial harm for adolescents when we're planning interventions, when we're looking at risk. So making sure we understand what's happening in the community and how that relates or doesn't relate and balances with the risks that might be happening at home, and how we don't minimize or kind of overexpose one or the other. And that remains a work in progress for us, but we've would really kind of promote the tools on the contextual safeguarding network. So Becky, if you could take me on a slide. This is just a helpful resource from some of the adverse childhood experience work that's happened. So in relation to adult safeguarding and some of what the partnership has done, we've been very engaged with the project that's been run across the city on adverse childhood experience, the HIT project, which I've just forgotten in this moment what HIT stands for. HIT. It's a health intervention project essentially that looks at integration of best practice, and we know that responding to the issues that I've just set out there is both about thinking about childhood adversity for teenagers, but also and what adversity they might have experienced in their childhood, which might be affecting how their parenting and their relational dynamics happen in adolescence. It's also thinking about how we respond to parents who've experienced adversity and what adolescence can trigger for them. So yeah, I put this in to kind of prompt me really to remind you all to kind of keep aware of some of the resources and support that's coming out of the ACEs HIT. There is a website that Becky can also put in the chat for us with some resources that links you to that project, but it's also about thinking in your services about what investment, what support, what can we get out there to support communities, families and young people to recover from adversity, and our collective efforts around that. Okay, could you click me on, Becky? So you'll have seen hopefully some of these actions that have taken place. There's been training and briefings for adult mental health practitioners. We're developing the links with the Rhodes Safeguarding Lead role. So Rhodes is our drugs and alcohol services consortium of providers for adults drugs and alcohol services. There's a vacancy currently, but I understand that it's being filled in their safeguarding lead role, and we're really looking at how kind of children's services can we can strengthen the links in the partnership through that role, and working with the providers. We did some great work previously with previous post holders on that. There's promotion of kind of Think Family online resources and offline resources, a lot of work through MANS meetings and some of our training around Think Family. We are in the process of developing some bite-sized training for adult colleagues and adult practitioners around child protection, child safeguarding. We hope to get that out this year, so that it's, for people who don't need a whole day but need some help to remind how our systems integrate. We have been involved in the contextual safeguarding scale-up project, and there's been a range of kind of assessment tools that people have been trialing and piloting, and continue to kind of have available and develop really to think about how we do that weighting between intra and extra familial harm. We're continuing to grow trauma-informed services for children in Bristol, and that's across a whole range of kind of commissioning and procurement and support, and hopefully you can sit and think about new services that you've seen, new funding streams in the last year or two, which has kind of been informed by the strategic work that we've been doing around this. Yes, so that's just some key headlines. Could you take me on, Becky, please? Okay, so I'm just going to have some water quickly. I knew you were going to hear a lot of me, sorry. So I got, yeah. But we're getting there, and then I hopefully hand over to you all. So you will have heard in our data that our most prevalent abuse type related to the death or serious harm of a child has been in relation to child criminal exploitation and serious youth violence. We, as Becky said, have done a whole 2 webinars on this, so one around safer options and one around the national review. So we don't have time to go into a huge amount of detail, but I wanted to kind of raise some key themes with you to hold in mind, and you can perhaps dig into some of those other webinars if you're interested. So there inclusion is a huge part of our response to child criminal exploitation and serious youth violence. The overrepresentation of Black young people, Black males, and young people with SEND needs is really significant, and links to inclusion across all services, but most particularly within education environments. So we can see absolutely clearly the escalation that happens after a child is excluded, either fixed term exclusion or permanent exclusion. We can also see a pattern through this work and also through some of our wider analysis of the impact of managed moves, and that absolutely accelerates a child's likelihood of being seriously harmed or killed in the context of CC and serious youth violence. Now, that isn't to put everything on our education colleagues. We know that some of these children have behaviours and dysregulated behaviours that become very difficult to manage in a school setting. But there is the importance of keeping children in school and working towards a kind of Glasgow model of having no exclusions at all is absolutely going to be our best kind of defence about reducing child criminal exploitation, without a doubt. And we have to really kind of question and ask ourselves around exclusion and inclusion and how we can support that, both as education settings, education providers, and the wider system, to really kind of promote engagement with education. And we can talk a little bit about what's happened to try and support that in the city in a minute. There is a need we've recognised to increase early intervention. So for a lot of these young people, you could see that they were struggling quite a long time before child criminal exploitation became really significant, and there were we could identify opportunities within that, and that was where young people who may have even have started struggling really in the sort of year 5 and 6 of primary school, struggling with their behaviour, young people where there had been kind of early incidents around kind of difficulties within school educational engagement, also kind of more lower level kind of antisocial behaviour, emotional dysregulation earlier, maybe need to access CAMS but struggling with that, not necessarily being able to access that service, SEN needs around behaviour often, antisocial around their kind of behavioural needs, and some links around kind of presenting and requesting support around ADHD, but also more widely children affected by their family and siblings criminality and risk. So we think there's like huge options there really to get in earlier and increase support, and also to respond at kind of key what we call reachable moments. So at the point at which a child's in custody, or there's been or is arrested, or presents at hospital with an injury, they're obviously kind of the higher end points. We see them at some of those points an opportunity to, where children are in really serious situations, help divert, and it's really important that we get in quickly at those moments. We see a need to broaden traditional safeguarding partners. We need the involvement of colleagues like licensing. We need the involvement of communities, absolutely, in this, engagement with neighbourhoods, and families coming on board alongside us as safeguarding partners. So we need to kind of be braver and shift our system around who comes around the table and how we work collaboratively. We also see the need to kind of, where interventions aren't just focused on risk, we need to be having interventions which focus on possibility and ambition, and shifting that narrative and label from risk of exploitation. We obviously need to name and work with that, but when what children are offered is an alternative, and missing plays a huge part in this. We see absolute correlation with children going missing, the importance of missing return conversations and really robust early missing support is, as you know, we should see missing as our opportunity, you know, all missing at the earliest opportunity as a kind of urgent message really to come around a child to try and reduce risk. We see opportunities to improve the response to managing retaliation and risk. So much more planning around where, after a serious incident, we know within this kind of context that there is a risk of retaliation from peers and friends, trying to understand that, getting the people who know those wider peers better engaged quickly is really important. And in terms of our children in care, we see some real opportunities to, they can feel quite dislocated from their communities. They may be living in communities which aren't the communities they grew up in. And we think they're often more dislocated from the community resources, the community support groups, and we need to keep building kind of our children's networks in the communities they're working with. We've really kind of put out to all of you, you know, your opportunities to be corporate parents. Our children in care in Bristol are our children, and we have responsibilities for them. So the opportunities for grassroots groups and others to kind of proactively engage with the children in care in that area. And I know often it's the barriers not knowing who they are, but so coming with us, working with us in our long-term care teams to kind of build plans around children or support children living in children's homes and communities. We've still got some work to go on defining the health role in safeguarding from CCE. We see some really good engagement from our health trusts in relation to some of the pathways after serious incidents, but a lot of our children, these children are disengaged from health services, and we think there is some opportunities, particularly around speech and language, particularly around trauma recovery and how we make them more culturally appropriate and more appropriate for peer groups. That remains a challenge and something we need to work on together. And we know that there are opportunities we need to not criminalise our young people and try and shift the systems around them that lead to that crime. So adult exploiters and county lines and the kind of drug supply network. So there's kind of a whole piece of work that needed around that, and the development of kind of location-based responses that respond to the places where crime and harm happens and the peer groups that happens in. If you could click us on, please, Becky. So this is just some of the pathway over the last 2 years which have resulted as a response to serious incidents. And I do really encourage you to watch Safer Options webinar, because this will take it through you, and through this, and we won't have time today to talk about all of these aspects in any detail. But you'll see that there's been kind of action right across health, police, social care, education, voluntary sector services. All of those are kind of key parts of our attempt to respond and reduce harm, and it's continuing, and we want you to be part of it. So yeah, please watch our Safer Options webinar or find out more from our Safer Options team. Okay, if you could take me on. Okay, sorry, it's going to feel like we're moving, you know, around subjects a lot, so take a breath and put your head into kind of another kind of area of practice. And I guess some of that comment from me reflects this this area of practice, because we have very low numbers of children harmed through harmful cultural practice in the city. Often when there is a kind of serious incident or significant risk involving a child affected by harmful cultural practices, it can be the first time that a group of professionals have worked with this issue. So when I talk about harmful cultural practices, I'm talking about forced marriage, honour-based violence, female genital mutilation, some kind of harms relating to concepts of witchcraft, for example. So there's a whole kind of range which would come under this heading. And what we really found is, because it is very, either very hidden, but also not something that most people are working with frequently in these set of circumstances in Bristol, it can be, that it is really important for early support from the specialists across the city, and nationally. So what we found from good practice, as well as areas for development, was the need for those individuals to very quickly access some senior management within their organisation if this is identified, the opportunity to speak to the police force leads if you're a police officer dealing with these kinds of crimes, so that they're aware at an early stage. Working with some of the kind of national bodies will be a really important part of a lot of these issues. So, for example, in relation to forced marriage, there'll be a need to work with the national organisations about kind of international safeguarding approaches. So there is a need for very early multi-agency coordination and for senior managers within organisations to be aware of that risk being identified, and within police and social care to access legal advice quickly around these areas of practice where necessary. I'm talking about when these concerns are at a significant and critical level, of course, and get advice from kind of the specialists within their organisation, and for us to have conversations at an early point within child protection strategy meetings, for example, about where our gaps and areas for development are in these pieces of work and what we need to find out, and do that in a quite targeted way. Where we've had kind of international safeguarding issues, so children from Bristol where the harm is happening in another country, but they're UK citizens and Bristol residents normally, there are some real challenges about working with other governments and working with other countries where there aren't safeguarding structures or the same legislation, and there are a whole range of organisations that can support social workers and police with doing that, but it's by no way easy, and often thinking about the network you have of people around you is going to be really important for you to be able to kind of think through the opportunities to kind of influence in the right places, but also not increase risk to the children by their identity being not increase risk to children, where you've got to be careful about who perhaps within the wider families and networks and communities are involved. So it's a really sensitive balance, and that's where getting support early can really help. But where we've seen some really excellent practice, there's been engagement with peer network as well, and extended family network to protect. So we've seen social workers and police and schools in some of these situations really engage with the friends around these young people to respond to incidents, and that those young people often needs a lot of support themselves, but maybe being contacted or getting information about their friends. So we've really needed to think about their ability to access kind of support and safety when they've had concerns. We've needed to think through some of the learning. It's raised that need for practitioners to think about the link between wider forms of gendered violence and the risk of harmful cultural practices. So by that I mean in families where there has been domestic abuse and or other forms of violence against women and girls, there isn't always a correlation, of course, but when doing the risk assessments where this becomes an issue or is identified as an issue, understanding the pattern of kind of previous behaviours in the family about or in the wider family about kind of gendered violence is a kind of really helpful starting point to inform assessments and kind of understanding what might be happening in those family dynamics. We need real curiosity and cultural intelligence around exploring family dynamics, and also not thinking that each member of the family has the same approach or the same understanding. So one of the rapid reviews we did, we could really see there were very different views between different parents in relation to some of these kind of cultural practices, and more widely though, before we got to that more acute critical point, around their approach to parenting and their response to their children. and there wasn't that exploration around how those tensions were managed in the family, and the engagement with both parents and the children to really understand what was happening within that family structure. And it's, yeah, and the kind of wasn't always the kind of curiosity, I guess, with the children about what the parenting approaches look like, and where and how that was experienced within the family network. Sorry, obviously, but we've got to be careful on all of these so that we're not kind of revealing too much detail about the individual situations. But I think the area as well around this that is really important is when we have on occasion can see the risk of making kind of sweeping cultural judgments about families, and actually and because of their ethnicity or race or religious background, and them really not being right, not being kind of based in those families reality. So that really personalized approach to understanding the family and the family network and who steps in, and how the family responds to children in these circumstances is so important. But the bit that I just really wanted to flag was there has been a gap we've identified where a child's been harmed abroad, perhaps on holiday, and returned to Bristol and disclosed that, and then not being supported to access specialist services. So, for example, if a child experienced sexual harm while abroad, not necessarily related to harmful cultural practices, but potentially, then it is really important that even if that is disclosed as happening outside the country, that we still use the survivor pathway, we still get them advice and support through the STAR clinic, that we follow our kind of existing good practice around child sexual abuse. Okay, Becky, could you click me on? So these are just a couple of the things that have been done by the partnership around these themes coming out of the child practice review. So you can see them on the slide, but the link around that lead professional for early help for some of these reviews we've looked at, what we've seen is, that the kind of harmful practice, be that forced marriage or honour-based violence, has happened at quite an acute point. And actually there was a whole period of time where there were families living in adversity, where actually the coordination of good early help responses would have supported them to kind of avoid really that path. But that lead professional, the importance of when FIF and social care aren't involved, there still being coordination for some families of a multi-agency response, to join up around the families is so important, and something we need to continue to work on and embed. Okay, Becky, could you click me on? Okay, I think this is our last theme. So this is just a kind of rattle through around organisational safeguarding. So some of our review into organisational safeguarding really raised predominantly with gaps in national guidance and legislation in children's services. So there's it's a very developed area in the guidance around adults in the response to organisations, and is part of the Care Act legislation. But in children, working together doesn't actually cover any harm that happens to children within organisational settings, really, in any helpful or great detail. There are obviously pieces of guidance, for example, around education settings, keeping safe in education, but we don't have the same structure around organisational safeguarding. So, for example, the LADO, who responds, who's also done a webinar, if you're interested, the LADO, who responds to allegations against professionals, predominantly works with around risk from an individual rather than quality issues across a whole provider. And sometimes the commissioning of providers is quite fragmented, so across NHS England, CCG, local authority, children's services, SEND, and so sometimes that quality information about providers can be lost, and there's sometimes a balance between the kind of role of the regulator, so like Ofsted or the CQC, and then the role of the commissioners and kind of where that quality framework comes from. So there's also issues. We have quite a few settings in Bristol, care and clinical settings, where both children and adults receive support or care. And sometimes the issues around adults are held in adults and children are held in children's, and we need to get better at kind of joining those up. We have kind of also seen it's interesting because it kind of models similarity to kind of how you want to work and think about families, because we want to understand the chronology of change over time and how sustainable change is. So when we see providers who maybe repeatedly have requires improvement or inadequate judgments and then get back to good and then go back down to inadequate and requires improvement, how do we understand that whole pattern and what that means about the organisation's ability to sustain safety in their space? And I think this is a really important point to sort of say to people, to recognise that children, there is a kind of high risk to children around being hurt in organisational settings. We've seen that across multiple reviews. There is, a risk from professionals to children in the same way there is risk within family settings, and sometimes increased risk. And so the need for safeguards in organisational settings is really significant. And those of you who've read any of the reports coming out of the independent inquiry into child sexual abuse will have seen, a lot of recommendations and learning in this area that we hope will be adopted kind of nationally over the next couple of years. But in terms of thinking as practitioners, some of the things we would suggest you need to think about is assurance across day and night, checking the basics are happening, that team meetings are happening, that people are appropriately trained, that there's managers on duty, that there's proper whistleblowing, and testing and checking that with both staff and records, that you're, depending on your role, obviously, that and that when we have quality issues about provision, that we engage with the professionals around the children who are accessing it. So often what is happening is commissioners might know there are issues and regulators might know there's issues, but that's not always well known by the professionals around the children who are actually going into the school or into the children's home, into the clinical setting. And we need them to be our eyes and ears. So we need to kind of engage with people better. And we also saw nationally kind of the challenges of bed sufficiency and placement sufficiency really impacting how able statutory organisations are to make quality improvement in the market. So we need to really address some of the issues about the market in relation to children's homes and some of our inpatient care settings, for us to also be able to deal with improvement, because sometimes we're in the kind of invidious place of there not being other options. So perhaps we may work with providers too long to try and achieve the quality we need. So there needs to be kind of wholesale kind of system change around that to address the kind of private market across the country. Okay, Becky, can you click me on? So I don't have much time left. Sorry, I think we put 25 past on here, but I know some of you might have to step off, but we'll obviously stay on for a few more minutes than that. I was going to take a breath and just give you 30 seconds to think about these questions. We have rattled through kind of thematic analysis really across a broad range of areas, which really shows kind of the breadth and diversity of experience for children and families in the city. So I'd just like you to kind of take a moment to think about these questions before you leave today. And it's an opportunity in that time to put any questions you might have for me or Becky in the chat. So if you just want to take a moment and do that, and then we'll take some questions. But if we can't get to them all, we'll perhaps do a bit of a kind of question and answer of anything that comes out of today that we can circulate or put on the website alongside the webinar. So yeah, I'll just give you a bit of time to do that and add any questions you might have to the chat. Okay, it seems that we have maybe stunned you to silence, which is absolutely fine. I really hope that you found it kind of a useful presentation, and that it's helped you kind of engage a little bit with what we've seen coming through the rapid reviews. What I'd ask is for you to go away today thinking about some of those questions. If you think there are areas, we clearly haven't done justice to all of those areas, and we couldn't in this time. If you think there's areas you'd like a more detailed look, perhaps not with me maybe, but with some of our specialist experts on any of those areas, we're really happy to put that on. So either put that in the chat or message us at kbsp@bristol.gov.uk. But it's just been so brilliant to see you all here today. 225 people on a Friday. It's just fantastic, and I think really shows the kind of importance we put in Bristol on learning from these kind of incidents, and kind of honouring those children really, and their experiences, and striving to do better. So I'd like to thank you all very much for coming today, and yes, I hope to kind of be in touch with some of you in the future. So thank you very much, and have a good rest of, well, I was going to say rest of the week, but have a lovely weekend. Hope the sun stays out. And thank you very much to Becky Dybal for her input as well.
Thank you. Thank you, everyone.
Thank you. Bye.
Bye-bye.